Biceps tendon right here. Normal biceps is like this right here, nice and white glistening structure. You can see the significant tearing of the biceps. I mean, so that was giving you so much pain. So the biceps gets incised here and just reattached to the front of the shoulder. Okay. Here's the ball or the humeral head in the socket. Starting to get a little bit of wear inside that joint, just a little bit. This approach that does not stay in. Had a few had labral tears throughout, and those got cleaned up and those got debrided. Okay. This is the underside of the rotator cuff tear. I'll show you a better picture of it in a sec. It's a good sized tear. Again, the joints. This is where the biceps was right here. This is where the biceps was right here. So the biceps gets moved in the front of the shoulder. Again, on top of the rotator cuff, there's just a lot of fraying, a lot of tearing because the tendon just keeps on hitting up against this bone here. So that area gets cleaned up and increases space in there. And this is right here. All right, that's called a subacromial decompression. Here's the tear. So it's just extensive tear. This is the front, this is the back. This front tissue actually was good, and I was able to get that tissue and attach it over here. The back tissue, there's just nothing there. And that on MRI, that was the area where you had the muscle was gone. So that tendon was also gone. Okay, so
is that by like the infraspinatus?
The infraspinatus, yeah, that was exactly right. So anyways, this is just the back side of the shoulder where there's the teres minor is attached, but the infraspinatus is gone. So anyways, this is supraspinatus. This tendon all came over nicely. So I was able to put 2 anchors, multiple sutures, those get passed through the tendon, and then I'll tie it back down to get us this right here and this right here. All right, so this looks really, really good, but it's supraspinatus. Now you still have the teres minor in the back, but the section back here, the infraspinatus, is not attached because there's no tendon, but it went fantastic. I mean, that's as good as, I mean, that was actually a really nice tendon that you had, and I'm glad you had that and not no tendon, because that would have been not so good, but that went really well. So the biceps got fixed, the supraspinatus got fixed, you had a bone spur that got removed, and the labral tears got debrided, so that went well.